Okay, so this is where we're traveling. Yesterday we drew a picture of the larynx, and I showed you what was directly beneath the larynx. What was that? The trachea. So that's where we're starting today. So start by making some of these rings here. Okay? You're like, those don't look like rings, they look like weird rectangles. Yeah. But if you looked at them from the top, they're rings. These cartilaginous rings are really, really important. Actually, they're not perfect rings. Actually, they're kind of C-shaped cartilages. So these are tracheal cartilage. Now that's what they look like from an anterior view. So that's what this is. What am I saying when I'm saying anterior? What's that another way of saying what? From the front. So we're looking at it from the front. Now if I look at the same thing from a superior view, this is what I would see. Okay. This is superior. For the ring is actually in the front, and the back is it kind of stops. So they're sort of C or U-shaped cartilages that wrap around the front of this. The back is just like muscular tissue and connective tissue back here, because back behind the trachea is the esophagus, and it has to have the ability to expand out. So it might smush into this space just briefly while we're swallowing food and stuff. These tracheal cartilages are super important, or the cartilages all the way up the bronchioles are really important because they keep airways what? Open. That's right. Without these rings, these airways would naturally collapse. So we have to have those rings to be able to keep them open. I'm going to go just a couple of railroad ties further here, and then we're going to go ahead and split off. And it goes left and it goes right. And I should have done it the same way I did the other ones, but I didn't. Now this little section where we first divided off here is called the primary bronchus. Gang, what's the difference between bronchus and bronchi? Bronchus is one, and then bronchi is the plural. Singular. Plural. Okay. Then we're going to continue this branching. They just like to branch and branch. Now the thing about these branches, you don't have to worry about making them perfectly even, because that's not how they're set up. Some of them are way bigger than the other ones, so you don't get an even branching. These branches develop much like the neuron branches in your brain, much like the blood vessel branches in angiogenesis, based on need. As we're developing, it just kind of develops and kind of pushes through, and wherever there is a need for a greater airway, that's where it goes. Where there's a need for a lesser airway, it gets smaller. It's really kind of a neat system. Does it change? The larger ones don't change much over the course of our life, kind of like our major arteries don't change over the course of our life, but the smaller ones can. Okay, after the primary, what do you think this guy's going to be? That's the secondary. And then after the secondary, was there another one on your quiz that you guys did, or your struggle? Tertiary. If there was another one and we kept naming them, it'd be quaternary and whatnot, but we're just going to, after tertiary, we're going to start branching off and just call them bronchi. We're going to branch off quite a bit. These are all bronchi. The bronchi are covered, they all have cartilage rings. These all have cartilage rings. As we get smaller and smaller, we don't necessarily need them anymore. In fact, we're going to go ahead and split it off here and not. Now this is where it gets weird, okay? So be patient with me. 1, 2, 3, 4, 5, 6, 7. Oops, I messed that one up. 8. Sometimes they branch off more than one. 9. 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22. Now at this point when I'm drawing these, they would be microscopic and impossible to see. Would I stop at 22, 23, 24, 25, 26, 27. Okay, we can stop when you get to 27.
Were you being serious?
Yes.
No?
Yeah.
No, I don't.
Can you get that word off the line, please?
Oh, sure.
There you go.
Right there.
I don't have enough words.
That's okay. They don't have to be very big, because as we get further out, they're going to be microscopic. 27 is an average. That's about how many airways you have. 2 to the 27th power. Somewhere on the order of 130 million airways, okay, in your lungs. About 300 million little air sacs. Yeah. All right. So this little thing right here that I drew that looks like low-hanging fruit or a weird grenade is, I'm going to blow it up over here a little bit. It is a cluster of grapes known as, what are the little grapes called? Alveoli. Okay. Now they are realistically, they're supposed to be little tiny sacs. Okay, individual little air sacs where the gas is actually exchanged. Do you remember the name of the tube, the last little tube that leads into those is? We had some controversy over it because I got it wrong the first time I wrote the quiz. I'll give you a first word, respiratory. That's what the whole thing is. We've drawn this as part of the respiratory tract. Starts with the B. I thought I heard somebody say. Bronchiole. Okay. Everything from here down is a bronchiole. Bronchiole are tiny airways. Oh yeah, they're tiny airways. They have no cartilage. These little tiny airways do not have any cartilage in them. So everything past here from the first few divisions down to where it gets really small, and their consistency is a lot more like that of blood vessels anymore than it is that question.
What's the name after alveola?
Yeah, air sacs. This would be air sacs. Thank you. The alveoli are the little air sacs where gas is actually exchanged. Okay. Now let me draw out to the side where we got a little bit more room on this side. Very, very simple bronchiole. Okay. So here's a bronchiole. All right. But what makes it different than the other ones is instead of having cartilage around it, it has smooth muscle that wraps around the entire thing. Bands of smooth muscle that actually wave back and forth. And it looks like DNA there, but bands of smooth muscle that wrap around these little tubes, okay? And then the inside here should be nice and open. It's kind of furry though on the inside because it's going to have all those little cilia covered in mucus. They're trying to catch whatever you breathe in, because you're breathing in pieces of the people sitting around you right now as they're shedding skin and so on and so forth. Dust mites, dander, pollen, all kinds of junk that's in the air, pollutants. You're breathing all that in. These hairs are trying to catch them. Okay. Now, let me show you something here though with this same deal. Let's draw that same one. Okay. But this time the muscle is contracted. This sometimes happens if your airways get constricted, muscle is contracted. That's not only in this case. In anaphylaxis, where people end up, they're allergic to peanuts or shellfish or bee stings and stuff like that, the muscles contract. So in this case, in asthma, you have muscles contracted. Muscle contracts. And then in addition to that, the airways are inflamed. So the airways are inflamed, they're swollen, and you have what happened to the opening where air can pass through now? It gets way smaller, which is why it's really hard to draw a breath in that condition. When muscle contracts on the outside, people have rescue inhalers and things like that. The goal of that is that albuterol is supposed to have a cholinergic effect where it more or less causes this muscle to let up so that these airways can open up again. Okay. We are just about done here. I've got one or two more little things to draw. Okay, actually probably just one. So let's look at one alveolus. Let you draw old Al down here with me. Okay. I want to draw two important players before I fill in the rest with the filler. Okay. Here's this guy right here. Pretty good sized cell with these little weird projections on it. Stuck on the wall at the septum, like where this might connect to another air sac next door, so it works for both cells. It's got little protrusions there. This guy, because it's on the septum between the two cells, is called a septal cell. Now I understand Marler was talking about this guy. He's an he's a macrophage. Those that have Marler, what's a macrophage do? That's right, it eats trash. It is a originally it was a white blood cell. It's cruising around here, eats trash. Because even with all the mucus and all the stuff here and all the cilia that we can trap that stuff in, there's still stuff that ends up in the alveolus. All right, let's finish this one out here. Oh, I should have drawn behind there. Doesn't have to be perfect. All of these cells here are what type of epithelium? Simple squamous epithelium. This guy's cruising around here. The macrophage is going through trying to find what other trash that ended up in here that we couldn't capture with the mucus in the lungs. Which is why our airways are not always as wide as they can possibly be. We don't want them to be as wide as possible because we won't trap as much debris. So they're only as wide as we need them to be. Now, if you're really, really scared these muscles will relax a bunch, and you'll get a huge surge of air going to your lungs. That's as your heart rate increases as well as part of the fight or flight response. Septal cell has a really important job. Okay, I'm going to jump ship for just a moment so I can explain why. Who did I just draw?
H2O.
That's H2O. Because water is polar, one end of it is negative, one end of it is positive. Okay? Where the oxygen in it is partially negative, where the hydrogen in it is partially positive. As a result, they form these little bonds between them called hydrogen bonds, which is not a big deal. That's why you can water ski, and stuff like that. But inside of here, it's a really big deal. Don't miss this, gang. Because water molecules are attracted to one another in a concept called cohesion. That water that's on the inside of the cell and the inside of the alveolus, the mucus, would do this to the alveolus naturally. Cause it to collapse in on itself because they're so small, their walls are so thin that it would collapse in on itself. So, as a result, we don't want that to happen. So we have septal cells producing lung soap, known as surfactant. And surfactant basically comes in and breaks apart those bonds in between the water molecules. It has the ability to disrupt that so that the alveoli can stay open. These septal cells are one of the last things to fully develop in the lungs of a neonate or a newborn, which is why they say lungs are the last thing to develop in babies, and if they're premature, a lot of times they have breathing and lung problems as a result of it because their lungs are not yet producing their own surfactant. So the alveoli, though they're there, they want to continually keep collapsing.